Morning, everyone. Really fantastic to be here and to spend the whole day today learning much more than talking. My very first Pathway conference, the then Chief Executive of Crisis fell off the stage backwards and cut his hand open in a serious way, and a number of eminently qualified people came up and rescued the situation and patched him up. I'm hoping to be slightly less dramatic this morning. And for those of you that don't know Crisis, we are the national charity for people facing homelessness, and we are utterly determined to end homelessness. We help 10,000 people in our services up and down the country, and we are campaigners. We're resolved to sort this issue out, to reach a new political reality where everyone has a home and everyone that needs support gets that support, and that the ethos of public services is primarily about preventing homelessness in the first place. We've worked really closely with Pathway since it was founded over 10 years ago, and the two organisations merged in 2021, allowing us to go further and faster in our shared ambitions. Homelessness always was, and still is, a health emergency. And in the last 12 months since your last Pathway conference, that emergency has grown both in scale and impact for the people affected by homelessness. Government figures showed that 3,069 people slept rough on any given night at some point in autumn, up a quarter on the year before, and reversing some of the good trends of previous years before that. The government committed to end rough sleeping by 2024, and they are sadly and dramatically going to fail. Temporary accommodation has shot up to an 18-year high. 99,000 households, including 125,000 children, are living in limbo every day and every night, and sometimes in squalor. 4,000 Ukrainian refugees, people who have been invited to live and thrive in this country, presented as homeless in the last year. In November, the Home Office dumped a busload of asylum-seeking individuals from the Manston Processing Centre in central London, and those individuals were just told to sleep rough. They were told, if you want, you can go next day down to the Luna House Processing Centre in Croydon, where you'll receive instructions as to what to do next. Some people did, and they were told by the Home Office, there's nothing for you here, you are now homeless, go and see Crisis up the road. Those people came to us, they were hungry, they were confused, they'd been lied to. Many had scabies, some were sent straight to hospital. Nearly 1,000 people died whilst homeless in the last data that we have, and the average age of death, as you all know, is decreasing, now at 43 for women. The number of households living in hostels, night shelters, beds in sheds, public transport, sofa surfing, the various forms of homelessness that there are, will reach 300,000 this year. And by comparison, in 2016, it was 167,000. This country is sleepwalking into a homelessness catastrophe. The government chose to do nothing about it at the budget yesterday. It chose to do nothing about the yawning gap between housing benefit rates and the true cost of rent, nothing about chronic housing shortages, and nothing to help the councils who up and down the country are increasingly unable to meet their most basic housing and homelessness duties. Awab Ishak was 2 years old when he died from a respiratory condition caused by the mould in his accommodation, his one-bedroom flat where he lived with his parents. His life was over before it had barely begun. It's been more than 2 years since Awab lost his life. And even now, with everything that's talked about, everything that's been said since, every kind of fist-waving accusation from Michael Gove about housing providers, we still see these cases every day. Last week, we saw a woman with Crohn's disease, asthma, without the use of her legs, living in a flat provided by her council because she had been homeless. They had no running water, black mould, and she'd cut off all social and family contact because of the shame of that housing. This week, a family in Edinburgh, 2 adults and 5 children in cramped temporary accommodation, infested with mice, rats, damp and mould, and the youngest child, a 1-year-old, has now been admitted to hospital with breathing difficulties. This has got to stop. This vicious link between homelessness and health inequalities is a political failure with brutal consequences. People are dying on our streets, they're wasting away in temporary accommodation, they're left in limbo to sofa surf or bounce from place to place, and all the while the government willfully neglects the true causes of homelessness. So we're at a crossroads. We either accept this reality of destructive inequality, or we use this next year to demand a different and better political settlement, one that solves rather than causes homelessness. And my ask of you today is simply to join that work and to realise and use your power. And you do have that power. Almost uniquely, we see a better sense of political response and progress when homelessness is seen as a health emergency and when you find your voice. We all know about the particular success of the Everyone In programme to provide short-term emergency safety for people from the first weeks and months of the COVID pandemic. And we should never forget that sense of urgency, can-do, resilience that was there, and all the collaborations that came from it, some of which survive to this day. But for me, there were much bigger, more fundamental changes that were made possible because all of a sudden, homelessness for a glorious moment was seen as unacceptable because it was a health risk. Evictions were stopped, local housing allowance was increased, universal credit was topped up. People with no recourse to public funds were for a brief moment treated as equal human beings. People fleeing domestic abuse were given a new right to rehousing. All this and more because homelessness combined with a virus was not okay. And as a result, we saw presentations to councils for assistance plummet. And a brief moment of clarity about what it would look like if we started to design homelessness out of our system. Homeless health advocates seized their platform. Listening to people like Andrew Hayward on Radio 4 talking about solutions to homelessness was amazing. Watching government officials listen and respond to inclusion health experts in ways that we mere homelessness advocates are not listened to was very special too. And these conversations, this campaigning, was replicated at local and regional levels, still is, with many of you in this room driving a sense of possibility, people like Gemma in London. And that radical, clear thinking, that authority that you have, born of the facts that you have at your fingertips about the health harms caused by homelessness, is what we need now more than ever. The biggest breakthroughs in homelessness policy across the world have come from you, they haven't come from us. The best example for me is the adoption of Housing First principles. And Housing First and its associated principles are the thing that are starting to break the back of homelessness in a number of countries now. Parts of the Netherlands, Austria, Spain, Finland, other places. Places that have realised and unlocked the truth that's there within Housing First, that unconditional access to housing, harm reduction, choice and control should be the principles that guide all of our response to homelessness. But Housing First was not a homelessness intervention or innovation. How could it be when our sector is so addicted to temporary and emergency accommodation, when we have an industrial complex of dealing with homelessness in that way. No, it was a community-based psychology response to homelessness. It was people like you simply insisting that you cannot treat acute mental illness or addiction issues without a safe and secure home. That simplicity, that clarity came from your sector, not ours. And so we must go again. It's our year, it's your year, to offer the same radical clarity that's broken through in the past. The challenges we face seem really complex, they seem deep, they seem intractable sometimes. But the truth is that I'm not doing my job and you're not doing your job unless we approach that with hope and determination. On an individual level, every time I meet one of our clients we call members and their homelessness is resolved through their own agency being restored, their own dignity being seized, you realise that there is no single instance of homelessness that cannot be resolved. So our only job here is to add that up and say every single case of homelessness can be solved, almost every single one could have been prevented, and so we must move forward with that determination. Many of you will have extraordinary stories to tell about the individuals whose lives are now set on a different path. You'll be able to talk about the moment that people started to receive the help, the care, the healthcare, the housing that really restored their prospects. Tell those stories. Tell policymakers. Tell the people that lead your ICSs. Tell anyone in authority. Better still, give the platform directly to people who have experienced homelessness so that they can tell it themselves. We know good policy makes the difference we need. That's why we continue to campaign and to fight with every ounce of our energy to bring change that will save lives and secure a future for the people that we are here to serve. We need your support for our campaigns in our sector, from Crisis and from others, and to lend your influence in advocating to improve the way we treat people and to restore a sense of equality to this country. And as we work for a healthier future, Crisis will continue to do what we've always done, which is to be relentlessly optimistic about the potential of every human being. With your knowledge and dedication, we'll continue to offer hope, we'll continue to work to end homelessness, and by working together, that's exactly what we're going to do. Thank you.